Everyone, Dr. Nemechek here, and I want to talk to you about hair loss, or hair thinning, or alopecia. Um, it's often made much more complicated than it is. Now, so if we put everything together in one big group, you can kind of break things out rather quickly. So one is just looking at your scalp. Now, there are some conditions like autoimmune disorders, psoriasis can cause hair loss. There is alopecia areata, where you have big round patches. You can have big round patches from infections. It's called tinea capitis. It's a ringworm of the scalp. Those are pretty big, pretty obvious things your doctor will pick up on. Obviously, chemotherapy, well, you would know that. That's not a surprise why it's happening. Thyroid being too low or way too high, thyroid function, well, that's going to get picked up on your basic lab work by your doctor, okay? Stress is a really common one, okay? It's called teleoeffluvium, and that's a mouthful for sure. And so taking care of an ill loved one, toxic work environment, studying for exams, things like that can certainly do it. And don't underestimate that stress. The other thing that's very common, that's missed a lot, because most of these other things are pretty obvious, but if your hair's coming out, all right, then the other major thing is just inflammation. It's very common. One of the things that happens with COVID, so you get this big surge of inflammation internally with COVID, even if you don't really have, significant symptoms. And that inflammatory stress will kind of shock your hair follicles, and your hair starts falling out. Now, if the inflammation goes all the way down, it takes maybe 4 months or so before people think, after that event, oh, it's quit falling out. It's better. What happens is all the damaged hair is already fallen out, and the remaining hair is healthy and stuff grows back in. But what if you just have kind of low-grade chronic inflammation, say from bacterial overgrowth, where it's coming out of the food supply, or you're exposed to a lot of smoke, bad air pollution with these 2.5 micron particles, things of that sort, then it's just persistent, persistent inflammation. And that's not going to stop unless you can lower the inflammation, And that's, our approach with the Nemechek protocol is just a general approach to lower the common inflammation from the common sources we have. Now, if you have an autoimmune disorder like severe out-of-control rheumatoid arthritis, that's going to be your source of inflammation, all right? But if otherwise you're healthy, your labs are okay, there aren't big patches in your hair, you aren't getting chemotherapy, or, even genetically, your dad wasn't completely bald by 35, you got to look at inflammation. And even a lot of these products you see being sold on television for hair loss, when I look at the ingredients, they're just a range of things that are lowering inflammation. They'll have curcumin, fish oil, maybe some probiotics are trying to balance the gut, lower inflammation there. And so it's all about inflammation. And that's what Nemechek protocol is about. I bet most people, you just get the olive oil in you, 2 tablespoons olive oil a day, and a pretty high dose of omega-3s, meaning a couple thousand milligrams a day. That'd probably do it for most people in terms of your hair growth. It's a lot cheaper than what they're hawking on television. You don't need a whole bunch of nutrients. Now, one of the other factors here is people are like, well, I need biotin. I take this biotin stuff. If biotin is helping your hair grow, biotin is normally produced by healthy bacteria in the intestinal tract. What that means more than likely is you have bacterial overgrowth, SIBO, SIBO, and that's preventing your normal gut bacteria from making the normal biotin. Okay, so if biotin's kind of the trick there, you got to think about, well, maybe I've got overgrowth and I need some rifaximin or Xifaxan to fix that. So anyhow, just quick touch on generalized hair loss, hair thinning. Obvious stuff your doctor will pick up right away with either just looking at your scalp or your blood work. And then beyond that, it's primarily these sources of inflammation from the food and from the gut bacteria. So hope you find that helpful. Everybody have a good week. Take care. Bye.